This is Foley catheter insertion. The first thing we're going to do is check our orders and then gather our supplies, which is going to be the Foley catheter kit and the stuff you need to provide peritoneal care. You are going to knock on the door. The patient's going to allow you to come in. You're going to come in, introduce yourself, wash your hands, identify your patient with 2 verifiers, meaning their name and date of birth or their name and MR number. Once you've verified your patient, you need to ask them, are they allergic to latex or betadine? Or more generally, you can just ask them, do they have any allergies? Sometimes they have the wristband that says that they're allergic to things, but then sometimes they didn't get it on for whatever reason. If they do tell you that they have an allergy and they don't have a wristband, you do need to make sure that they have one of those when you finish your Foley insertion. If they do have a latex allergy, you cannot use this Foley. There's a specialized Foley that you need to get. But then once you've verified that this is the right patient and you have the right size Foley against your doctor's order, you need to make sure that you check the size. This one is a 16 French. The balloon is a 5 cc balloon or 5 milliliter. And you also need to check the expiration date on your packaging and make sure that there are no tears and that your package is intact. Then you are going to lift the bed up to a workable height, which means your waist. You don't want to strain your back trying to bend over. This whole time, while you're doing everything and getting prepared, you need to make sure that you're talking to your patient also. You're not just going to be going through the motions in the real world. For the checkoff, you're going to be paying attention to your patient and doing what you need to do. But when you're dealing with a real patient, you want to talk to them and just not maneuver them without them knowing what you're doing. But you need to pull the sheets down. Ask the patient, are they okay being exposed? They will say yes, we hope. You're going to roll this down and not put your scrubs on their covers that go on top of their body. Then you're going to lift up their gown, and again, always ask for permission, and then you're going to position them. Ask your patient if they're able to provide their own peritoneal care, and if they are, you're going to go ahead and allow them to do it, and you're not going to do it for them. Then you need to put on some gloves. This person does not have a chuck or moisture barrier pad up underneath them, so you're going to have to put one on the bed, because otherwise you're going to provide all this care and the betadine and everything that you do, and it's going to soil the linens, and then you're going to have to completely change the linens when you're done, and we don't want that. So while you're putting the chuck pad on there, you need to make sure that you're moving the Foley with your patient. So you're just going to set it right there in between their legs and ask them to assist you in rolling over. And once they roll over, you're going to put this pad underneath them. There's lots of debris under here, which means that the person who took care of my patient is basically going to give them a wound or more skin breakdown, because there were lots of syringe tops and things on this bed. So again, you're going to position your patient appropriately, which means legs in the air, so that you can get to the Foley. Your peritoneal care. You're going to have just water in here, or you're going to have rinseless soap. And you're going to provide care on the outside, using another side of the towel, this outer side, down the middle, and then your one last time is going to be along here. Just basically what you're doing is trying to make sure that you don't insert any bacteria into the vagina as you're pulling this out. Once you're done with peritoneal care, you put your towel away, and then you'll come back to this later. I don't mind if you put this on the floor for now, but then just remember, when we're all done, you're going to clean up after yourself. Then you're going to take your syringe, insert it, and deflate your balloon. So it just backs out on its own. Once it's deflated, you need to check your orders to make sure that how much you put in is how much you get out. So if the person before you put in 10 cc's or 10 mLs, you need to pull out 10 mLs. This person put in 7 before me. So you're all done with this. You're going to go ahead and put it in the trash. Then you pull out the current Foley. If there's any urine in the Foley bag, You need to empty it out, measure it, and describe it in your notes before you trash it. If not, then you just go ahead and put it in the trash. So we're going to go ahead and trash this. I'm going to take my gloves off and wash my hands. So now with clean hands, I am going to insert the new Foley catheter. You need to make sure that your table, again, is at waist height. Your bed may be just a tad bit lower, but it needs to be, again, enough for you to have proper body mechanics. I've checked and verified that this is all intact. Everything is not expired. There are no tears on my bag. If there was, I need to get a new Foley kit. I'm going to open my kit. This one is stubborn. Now sometimes people like to use this as a trash bag. So I'm going to put it here and just show you, if you do use it as a trash bag, what would you do with it? I don't use it. I keep my trash can right under where I'm working, and I toss everything into that trash. Remember that your hands can never go below your tray table, otherwise that's considered not sterile. You're contaminated. So I'm going to take this and just put it in the trash. And if you miss, you miss. Your whole thing and your whole objective is staying sterile. But you're going to open your kit always away from you first. So you need to reach around, grab the flap, let it fall down. Grab this flap, let it fall down. Your last flap, it's going to fall. And then this one, you're going to take it and turn it and position the Foley where you need it to be. Because remember, you still have to put your gloves on. And you have a 1-inch parameter around your Foley kit. Anything beyond 1 inch, you cannot touch or mess with. Your drape is on top. So again, with my 2 fingers, I can grab my drape. You're going to grab your drape and not touch anything else inside of the Foley kit. You're going to open your drape by not shaking it. If you shake your drape, you have contaminated it and you are no longer sterile. The shiny side of your drape goes down. You're going to step over to the patient and just let it lie flat. If you did need to make readjustments, you're going to ask the patient, is it okay for you to reach around them? And then you're going to straighten out your drape by basically reaching over their body. You're never allowed to cross this way over your drape. Otherwise, you contaminated your field and you have to start all the way over. The next thing in your kit is going to be your gloves. Again, with your 2 fingers, you can touch the outer portion of your gloves because that part's going to go on your tabletop anyhow, but you can't touch anything inside this glove kit. Otherwise, you are being contaminated. So you're going to scoot to this side. You can never turn your back to your sterile field, but you can maneuver to where you can see it in front of you. So come to the side of your Foley. When I provided privacy, my curtain was in my way, so just be cautious of that. And then you need to do your dominant hand first. So I'm right-handed. I'm going to grab my right glove on the inside of the cuff. I cannot touch any other portion of this glove but the portion that's going to touch my skin. Then I'm going to grab this glove. I can touch it anywhere I want to because it's sterile and sterile. But once I'm touching it to my dirt or my clean hand, I can't, again, touch it any other way. So now I'm sterile. This guy, we don't use anymore. So don't bother with it or make yourself have a headache about it. Just go ahead and put it in the trash. So now you are ready to maneuver inside of your Foley kit. Everything in here is sterile. So from this point on, you are going to be 100% sterile. We are not taking a urine sample. So again, I'm getting rid of things I don't need. It's going in the trash. My iodine, my forceps, my lube, and my saline is all that's left in here. So I'm going to turn this over. Remember, I have 1 inch that I can't touch, but I'm going to take my saline and I'm going to attach it to my Foley. That way when I go to transfer it over here, it's good to go. Also, because inside of my box is still sterile, what I'm going to do is I'm going to lubricate a section of my kit top. We're going to throw the lube in the trash. We're going to set this inside the lubricant. So that way when I'm ready to go, it's good to go. For my female patient, I need at least 3 inches. For my male patient, I need 8 to 9 inches of lubricant. So just be mindful of that. Then I'm going to go ahead and open my betadine. And you have to be careful for splashing. Because remember, if betadine splashes anywhere outside of here, I've contaminated my sterile field also. So you have to keep it inside here where your cotton balls are. And then we're just going to get rid of that. And then trash it. Take your forceps. Make sure that you've lubricated these cotton balls as much as you can. And because you perform pericare before you've inserted the Foley, it should be easier. You should only need 3 cotton swabs of betadine. But now you have 2 choices. You can either take your whole kit